we've actually gathered here today. Thank you for watching. The topic of today's webinar is the effects of CBD. I'll start with the very first question. Paja, how does CBD work in the human body?
Good day to everyone present from Zelená země. So, CBD acts in the body like most cannabinoids, by binding to endocannabinoid receptors. Specifically, CBD stimulates these receptors indirectly, unlike, for example, THC.
Thank you. Next we have, what are the most well-known effects of CBD?
The range of effects is truly diverse, but of course one of the main effects is sedative at higher doses, while at lower concentrations it can actually have a more stimulating effect. It definitely has a strong anti-inflammatory effect, as well as antidepressant and antipsychotic properties. These are the basic effects that are more or less described for CBD. Of course, there are also effects on neurological problems, so it has a neuroprotective effect by protecting brain cells, and you could say it generally protects our central nervous system from aging, and it also has a strong antioxidant effect. But as I said, if we were to list or name each effect individually, we could be here for a much longer time, because the effects of cannabinoids are truly diverse.
Thank you very much, Paja. And now, the difference between quality and the resulting effect. Is there any difference? Because nowadays there are a lot of oils on the market. Of course, the quality can vary, and for example, both of us have definitely encountered this in our practice, where customers bought some oil, maybe it wasn't of such good quality, and therefore it didn't have the desired effect for them. Can that happen? Does it happen?
Definitely. Of course, it depends on many factors. It's always important to go for what's called a broad-spectrum oil, which doesn't just contain one isolated component, as is the case with isolates, but of course includes everything that the cannabis plant has to offer. Thanks to that, you get a synergistic effect. Nowadays, even broad-spectrum oil can easily be disguised, so basically only the base is broad-spectrum and the rest is topped up with isolate crystals. So, as a result, the end user really has a very difficult time choosing the right product that truly contains a genuine broad-spectrum extract, one that has been properly purified chromatographically and not just made by adding cheap isolate.
So since it's a dietary supplement, I suppose it's best to just choose a reputable brand?
Definitely.
Preferably one that has been on the market for a while, whether it's Zelená země or any other brand that's been around for some time and where customers can be confident about the quality.
Definitely don't go for the cheapest option because of course price doesn't always reflect quality, or the other way around. Of course, lower prices don't always guarantee higher quality, so it's best to focus primarily on user reviews and the company's history so you don't get scammed, because as I said, these days it's really difficult for the end user to navigate the CBD market properly.
Thank you, Paja. Now, is CBD psychoactive? Will I feel high after taking it?
It's definitely not psychoactive. Of course, our oils contain the permitted amount of THC, and I even had a case of a particularly sensitive lady who could actually feel even this small amount of THC, but that's one in thousands, you know. In fact, during my entire therapeutic practice, this was the very first feedback I received where someone reacted so sensitively. Otherwise, CBD in general is of course not psychoactive. That's also why it's legal. It actually has more of a sedative effect. There are certain side effects that can of course occur, but I think we'll probably get to those later when we address the specific questions from our customers.
Exactly. So now we'll just wait here for a moment. We made ourselves a quick coffee before the webinar, so we'll wait until the coffee machine finishes up and then we'll move on to the next question. All right, great, sorry about that. What should I consider before I start using CBD? This actually ties in with the next question, which is whether CBD is suitable for me or not. Are there people for whom CBD really isn't suitable?
I wouldn't really say so. Of course, it's good to first consider what medications and dietary supplements a person is taking, because there can be certain contraindications, especially with blood thinners. It can cause a kind of reduced metabolism in the liver, so with some medications it increases their effectiveness. So of course this can lead, for example, with warfarin to an overdose. So it's definitely a good idea before someone starts taking CBD to consult our advisory service, for example, and ask about any possible contraindications. Of course, these contraindications can be easily, you could say, or we can easily prevent them by choosing a daily dosing schedule so that we don't interfere with the time when the given medication is administered. It's definitely good to maintain a certain interval between them. Of course, for people who suffer from low blood pressure, CBD can actually lower blood pressure, so I would be cautious here. Avoid any sudden movements right after application for about half an hour, and just handle the product carefully, especially if someone already knows they have low blood pressure.
So it's really about individuality.
But otherwise, in general, there really isn't any specific medical history or pre-existing condition that would outright prevent an individual from safely using CBD. It's always truly about a thorough consultation and a personalized individual approach, because every single person is uniquely different, and of course CBD can have very different effects on various individuals.
Right? What concentration or which product would you recommend starting with? You already mentioned that it's very individual. So now, based on your own experience, if we look at it globally, with dozens of people reaching out to you every day, what is the most common product these people choose?
Definitely the most frequently chosen product is the 10% drops.
I'll take them out to show them.
Because it's kind of a golden middle ground, even from an economic perspective. Of course, there are various recommendations online, dosage calculators based on weight and so on, which may or may not be far from the actual truth when it comes to dosing. As we've already mentioned, every individual is unique, and each endocannabinoid system is developed differently. For that reason, microdosing is recommended, so you might start, let's say, you don't have to begin with just one drop if you know your problems are acute or you have several of them. Maybe start with 2 drops 2 or 3 times a day, but definitely don't take the full dose that some calculator might suggest. It's always really best to split up the dosage and choose so-called microdosing, because of course, as I said, every individual can react a bit differently to a given concentration and the amount of that concentration. And then, of course, if you unnecessarily increase the dose too much at the beginning, you might exceed or overshoot even a lower dosage that would already have a sufficient effect for you. So, in a way, the economic aspect of the matter is also being considered. So, to sum it up, it's important with microdosing to start with small doses several times a day and then gradually increase them roughly every 3 to 5 days. At first, it's possible to increase the dose more quickly, and then as the daily dose gets higher, it's better and more beneficial to give that daily dose a longer period of time so that its full effect can manifest. Of course, it also takes a little while for the receptors to become saturated. Yeah, and as I said, if you overshoot it at the beginning, you might end up with unpleasant side effects, and honestly, from an economic standpoint, it's not ideal for the person either. So there's no need to rush. It's always possible to add more, but it's much harder to reduce the dose once you've gone too high.
Actually, as part of our cannabis counseling service, we stay in contact with you throughout the entire process, including dosing and using the product. So whether it's with Paja, our colleague Kuba, or even with me, we consult everything together and provide feedback which then guides the next steps in dosing. Just very quickly, this is a question that just came to my mind, but since we actually have capsules here, we have the oil that we talked about, the drops, and then we have hemp oil in fish oil. So about those capsules.
The main and biggest difference between these two products is actually the speed of onset and the duration of the effect. In general, it is recommended with cannabis to use a form that delivers the active ingredient as close as possible to the core of the problem. So of course, if the problem is primarily in the head, neurological, neurodegenerative, depression, anxiety, it's good to choose drops, because the route from the oral cavity to the brain is much faster. On the other hand, for issues like gastrointestinal problems, ulcerative colitis, Crohn's disease, or if a stronger sedative effect is desired, capsules are chosen instead. They take effect in about 3/4 of an hour to an hour and a half, and the effect lasts up to 8 hours. The drops, on the other hand, start working in about half an hour, and their effect lasts up to 4 hours. After that, of course, it's a good idea to choose a kind of combination where during the day you use drops for a faster onset of effect, and in the evening, when you need relief from the discomfort for as long as possible, you opt for capsules so that the effect lasts for the longest possible period in the evening.
Perfect. Thank you so much, Paya. We've now summarized our own questions here, and now we'd like to take the questions that our customers actually sent us before we started this webinar. So these are already specific questions. I'll read them out and I'll ask you to answer them, Paja. Good afternoon. I used CBD drops for 3 months last year, and my long-term migraines completely disappeared. However, what happened was that after 2 invasive and simultaneous examinations, gastroscopy and colonoscopy, I suffered a stroke. Specifically, I developed a blood clot in my carotid artery. As a result of this incident, I fully recovered, and after 5 months I was completely fine. However, since then I have been forbidden to use CBD drops, but since then my migraines have returned. So I would very much like to ask whether I can safely use these drops again, and at what specific percentage strength, because the medical doctors I have consulted about this particular matter don't seem to know anything at all about CBD drops. Your answer would help me a lot, because unfortunately I can no longer take the original migraine medication, such as sumatriptan, that is mentioned here. Thank you for your answer. We also encounter this from time to time, that doctors simply...
Unfortunately, it happens quite often that doctors, you could say, forbid the patient from using CBD without really having any awareness about it, which I find rather strange. I don't understand why they forbade her from using CBD, because I don't see any problem with it, and for migraines it often works very well, whether in terms of prevention or in reducing the frequency and symptoms of migraines. Here you already have, you could say, a good foundation, so I would probably recommend starting with the concentration you ended up with, roughly at half the dose, and then gradually increasing it again. Yeah, honestly, in my opinion, if the lady already has experience with this and has had positive experiences, then from my side, this advice is probably the best, because she already knows what to choose, how to choose it, and how to apply it so that it suits her personally.
Great. We also have a great article on our website about CBD and migraines, so I definitely recommend reading it.
But I definitely wouldn't get rid of it unnecessarily, because I don't see any reason to.
So now we have another important question.
And actually, a colleague had an interesting question from behind the scenes, whether after the artery was put to sleep, she's taking any blood thinners, which might have been a reason for the doctors, let's say, to prohibit her from using CBD based on that. Again, it's like this. For example, with warfarin, the contraindication is of course real, but the point is that if a person consults with their doctor and is monitored for blood thinning every 2 to 3 weeks until a stable daily dose of CBD is established, nothing can really go wrong, because the doctor can respond and adjust the warfarin dose if necessary. So this actually reduces the blood thinning effect. So it's definitely not the case that someone taking warfarin is automatically banned from using CBD. It's more about discussing it with their treating physician, making sure that they know this side effect exists, it's proven, and they'd like to use it, but they just need, let's say, some kind of...
I see. Some advice and some guidance to point them in the right direction.
Exactly.
So can CBD or cannabidiol have any potential side effects?
Definitely, of course, like any substance, if you overdo it, there will be side effects. Here, in fact, it's quite the opposite. What it can improve at a relatively normal dose, at higher doses, or in cases of overdose, it actually has the opposite effect and worsens those symptoms. For example, a person may become restless, nervous, and may experience nausea. These are some of the most commonly described side effects. Of course, there can also be dizziness, drowsiness, and spatial disorientation, especially in people who really suffer from low blood pressure. But generally, you can really prevent this by starting with a lower dose, which is gradually increased.
Great, thank you. Now the next question. Hemp oil in fish oil. I already showed it on camera earlier with CBD. Can it cause bleeding, for example, a burst blood vessel in the eye? I read that it contains rosemary, and rosemary causes me those kinds of problems.
Well, of course, if the person knows that rosemary isn't really suitable for them, then here, of course, it's present in the extract as a concentrate, so it is included, and you can even taste it in the flavor. So, of course, if she knows that rosemary doesn't agree with her, then unfortunately this product isn't really suitable for her. Otherwise, in general, of course, I recently had an interesting business meeting with one of our clients, and she pointed out that rosemary can slightly disrupt blood pressure in certain types of people. So if the person knows that this specifically applies to them, I would be cautious with that product, but...
Choose alternative.
Yes, pure CBD, exactly right.
Or even CBD tea?
But it's definitely not the case that this product causes what the lady describes for everyone or even most people. It's very individual, and really, if someone reacts badly to rosemary, it's best to simply avoid it. There's not, in quotes, a lot of it in there, but it's not a small amount either.
Okay, thank you very much. Next question, how to use CBD for pain. What works for different types of pain, and what about mild chronic headaches? We've already talked a bit about headaches earlier, so let's take the question more generally. How to use CBD for pain?
Of course, CBD doesn't have the same analgesic effects as, for example, illegal THC, but it does have its own potential. Again, it's very individual. For pain, I personally tend to strongly recommend capsules, which typically have a much stronger internal systemic effect. So for polyneuropathic pain, general neuropathic pain, or even persistent joint pain, I would most definitely recommend capsules over oil, and perhaps also supplement this with some kind of topical application, such as a soothing ointment. But as I said, the analgesic effect of CBD is again quite unique, and for joint issues it's really 50-50. So it's definitely worth trying, because there is potential here as well. It can, of course, also enhance the effect of analgesic medications. So when combined, analgesics with CBD, you can actually achieve a certain synergy where the CBD dose is stabilized at a certain level, which then allows a person to reduce their use of analgesic medications.
Thank you, Paja. CBD during pregnancy and breastfeeding. Yes, no? Why? That's a pretty common question.
The important thing to realize is that as infants, we actually receive endocannabinoids through breast milk. So in breast milk, there are substances that are chemically very similar to the phytocannabinoids found in the plant. So, of course, unless the person is using some extreme doses, primarily, let me put it this way, I've read studies where cannabis used during pregnancy is not recommended, but those studies focused on chronic users who consumed cannabis in the form of joints, where, of course, but the main issue wasn't even so much the THC itself, but primarily the tobacco that is mixed with the joint. So there really aren't, you could say, any clear studies that would demonstrate, let's say, any harm from CBD. On the contrary, it's actually one of the few herbs that is truly recommended because it can relieve a whole range of symptoms that you as ladies experience during pregnancy. Nausea, vomiting, for example, sleep problems and so on. So I definitely wouldn't say I recommend it outright, but there is certainly an option to use CBD during pregnancy and mothers don't need to be afraid. I would definitely recommend combining it with, for example, seeds or protein.
Speaking for myself from my own experience, I used CBD throughout my entire pregnancy, and it really helped me, whether it was with nausea or, for example, when I was breastfeeding, I used hemp protein. My daughter grew up, she's 2.5 years old now, she's very clever and smart, so it definitely didn't leave any negative effects on her.
And we really have a lot of clients and patients who use it and are very satisfied. And it's not like you have to be particularly cautious or that there's any risk involved. If it's used in moderation and with Franta, then it's perfectly fine.
Do you have experience with CBD curing or at least helping oncology patients?
This is, of course, quite a sensitive question, a sensitive topic. I don't want to say that cannabis actually cures cancer because, of course, there are certain studies that suggest it might. Then there are also certain studies that suggest it does not. Of course, I have many patients who have used various forms, different concentrations of certain substances or preparations with different compositions, and it really helped them, even cured them. But there could have been a synergy of several factors, whether conventional treatment, some self-discipline regarding diet, psychosomatics. So it's definitely not just about cannabis. Cannabis is the herb of all herbs, definitely. But when I advise my patients with oncological problems, I tell them to approach the issue holistically because it's not just about cannabis. So, the clearly proven effects of cannabis are in alleviating the side effects of conventional treatment. Nausea, vomiting, depression, pain. In this regard, yes. Here, truly, this is a solid fact we can rely on. As for the direct causal effect on the tumor itself, that is, inducing apoptosis in the cancerous cell, there are a lot of variables here. The type of cannabis used, the form, the dosage, and so on. So, in this case, it's very individual, but it is definitely an herb that I can recommend.
All right. Thank you very much. CBD and rheumatoid arthritis?
Here I could talk much more extensively about this topic.
Maybe a topic for another webinar.
Most likely, yes, definitely. If the person in question wants more comprehensive information, they can contact me. But in this case, CBD definitely helps because rheumatoid arthritis actually causes inflammation around the joint apparatus, especially in the small joints of the hands and feet. And as I mentioned at the beginning, CBD has anti-inflammatory effects. We have many patients with various autoimmune diseases. Whether it's fibromyalgia or rheumatoid arthritis, these conditions are very common, and in about 85% of cases, there is a significant reduction in symptoms and an improvement in quality of life.
Okay.
Whether it's in the form of drops, but CBD, CBG, I recommend a combination and also local application as an ointment.
First of all, CBD detoxifies the body and cleanses the liver. And it also has an effect on menstrual issues every month, hormonal imbalance, and PMS. Before I let you speak, I think it's also worth mentioning our new tea, which we have for women with the Herb Ladies Mantle, where there isn't a high concentration of CBD, but there is a synergy between the herb, hemp, and Ladies Mantle.
In my opinion, this tea is particularly suitable for this specific question. As for detoxification, yes, I do have pediatric patients for whom it actually kickstarts the detoxification of the digestive tract, so both the frequency and consistency of their stools increase. This herb is so clever in this regard that for some people it can trigger a certain detoxifying effect, but that's definitely not the herb's primary effect. For its primary effect, there are much better, more natural remedies. As for cleansing the liver, I can't really say that either. Yes, of course, we also have receptors on the liver, and it can beautifully regenerate the liver even after cirrhosis or, let's say, some chronic liver diseases in alcoholics. So in these cases, I can definitely recommend it. But specifically for liver cleansing, I would rather recommend a good quality milk thistle.
Great, thank you very much.
And maybe supplement it with cannabis. And regarding menstrual issues, I could easily recommend to the person a video I recorded with a lady who specifically focused on PMS and menstrual problems. Of course, it's possible, and here we can again recommend it, because CBD, whether through its effect on the psyche, can help alleviate certain hormonal fluctuations, which are subsequently connected to one's mental state. So in this case, it's definitely a supplement we can recommend.
Thank you. Multiple sclerosis and products that would be suitable. Thank you very much for your answer.
Here, it's primarily, it's similar to rheumatoid arthritis. It's a longer topic, something that would take more time to explain. But again, there are already plenty of records and indications.
Here, the lady is also asking about specific products.
Specific products? I would definitely recommend combining CBD, either the 20% or 10% with CBG, and possibly supplementing it with some food product, oil, seeds, or protein. But as I said, I'd rather the lady contact me through the counseling service. I'll be happy to discuss everything with her, because then it's also about the suitability of other herbs and dietary supplements. I'll go through, let's say, how her multiple sclerosis started to manifest, and if needed, we'll recommend some comprehensive therapy.
All right. CBD and psoriasis.
Definitely. So this is, of course, a dermatological issue again. Psoriasis is more or less a problem, or actually every dermatological issue stems from our internal environment, because the skin is the largest organ of our body, so any disharmony of certain malfunctioning organs is reflected on it. So I would primarily focus on systemic treatment, for example, using a combined CBD and CBG oil, because CBG nicely regenerates skin cells. There are certain studies on this, so it can effectively support the body's own processes, which might be exactly what's needed in this case. A factor that then causes psoriasis, and definitely some topical application or possibly a shampoo.
And that's exactly what I wanted to say. By the way, we actually have some fresh feedback. Yesterday, a colleague told me that one of her acquaintances tried our shampoo, someone who has severe psoriasis on the scalp, and he just can't praise it enough. He says it's really top-notch. So definitely combine it with the cosmetics as well.
Or you can actually make hair masks from hemp oil, if you have psoriasis, that is. Use hemp oil internally, 1 to 2 tablespoons, not this one, but of course you can use this one too. But ideally the classic cold pressed from seeds, which nicely balances, let's say, the ratio of essential fatty acids and actually nourishes the skin from within, softens it and hydrates it.
Great. So multiple sclerosis.
We've actually already answered that, right? That's basically multiple sclerosis. So here, as I said, ideally, because if we were to focus specifically on that problem.
There are also independent sleep issues here, right? So that's multiple sclerosis.
And sleep.
Exactly, sorry. The type of oil and dosage.
Here, I would definitely recommend capsules, because since they are absorbed primarily in the digestive tract, they should have a somewhat stronger sedative effect. It's great to combine it, for example, with a 4% tea, and I recommend that if this therapy doesn't work during the first cycle, then add CBG, which should enhance the sedative, both physical and psychological effect of the CBD. Generally, you start with 1 to 2 capsules about an hour before bedtime. You can have the tea, say around 6 o'clock, put a tablespoon of the herb into a cup, add a drop of some fat or alcohol to provide a medium for the active substances to bind to, and then pour boiling water over it. Let it steep for 15 to 20 minutes, no problem. After that, don't throw away the herb, because about 40% of the active substances are still in there. So you can nicely recycle it like this and basically use the same infusion. Maybe let it steep even longer and have it around 8 or 9 o'clock. So tea, capsules, and then maybe another cup of tea before going to bed. Of course, some people don't like to drink tea before bed because it makes them go to the bathroom more often, so they can just choose the capsules, or possibly combine them with CBG.
It's individual.
But usually the effect on sleep is present in almost every patient. Most of the time, people actually describe it more as a side effect. They initially ask about or seek out the product for a different purpose. And then, when giving feedback, they mention that their sleep has significantly improved, the quality of their sleep and its duration.
I also have personal experience with this now. I actually gave CBD to one of my friends for hormonal balance, and she told me, wow, ever since I started taking those 10% drops, I sleep like a log. Really? So I can totally confirm what you said. Last question. I'll read it and I guess I'll answer it myself.
Yes.
Because this one is about dogs, since Paya mainly advises people and I focus mostly on animals. And here a lady or gentleman is asking, I have a Prague Ratter. He's almost 16 years old, has high liver values and a weakened immune system. Is there any product I can use to help him? If so, which one? So just like Paya was talking about detoxification for people, for the liver I absolutely recommend, in addition to hemp, also giving milk thistle oil. And when it comes to harmonizing bodily processes, then definitely with CBD oil, but specifically for dogs. With animals, we really emphasize giving them CBD oils specifically for dogs, which do not contain THC, are approved veterinary products, and are subject to some form of oversight in their production and distribution. Since dogs have a more sensitive endocannabinoid system, we know that these products do not contain THC, which could be toxic for them. If it's a Prague Ratter, which is a small breed, I recommend choosing a 2% oil, and at first giving 1 drop in the morning and 1 in the evening. After a week, you can increase it to 2 drops each time and see how it goes, maybe for 2 or 3 weeks. I recommend getting back in touch with us. We can discuss it and figure out what to do next. I've actually already touched on how we operate here. At Zelena Zemlya, we officially have 3 consultants. There's Paya here, who specializes in CBD in general. He also specializes in CBD for children. Then there's me. I can also advise people, but I mainly specialize in animals. And our colleague Jakub, who handles the customer chat, which we have online 5 days a week, though we also respond on weekends, answers your emails. For very complex diagnoses, he naturally consults with our colleague Paya as well, so all your questions reach us. If you send an email to info@zelenazemlya.cz, your inquiries will get to everyone. Specifically, Pavel can be reached at pavel.čermák@zelenazeme.cz. My email is lucie@zelenazeme.cz. And you can reach our colleagues either via chat or through the general info email. So we'll be happy if you get in touch with us. We're always happy to give advice with a smile and free of charge, and we see it as our mission. Thank you so much for watching us today. Thanks also to Paya.
Thank you as well.
The answers were once again thorough, and we look forward to next time.
And if for anyone the answers weren't sufficient, as I said, just reach out to our advisory service. Ideally, of course, by phone. It's faster, you'll get quicker feedback, we don't have to exchange so many emails, and usually whatever we discuss during the phone call, we then summarize everything in an email so that the person has a sort of guide how to approach it, the dosing and the treatment.
All right, thank you and have a nice day. Have a nice evening. Goodbye.
Bye-bye now.